Welcome to the Canadian Concussion Centre webinar series that's sponsored by the Laborers International Union of North America, LiUNA. My name is Carmela Tartaglia, and I'm very pleased to be moderating our webinar series developed for individuals that have suffered a concussion, their caregivers, and healthcare providers. The sessions recur every other week, live on Tuesday evenings from 6 to 7 Eastern Standard Time. The sessions are also recorded and available for subsequent viewing on the Canadian Concussion Centre website. Each session focuses on various aspects of concussion and includes an expert speaker presentation for the first half of the session, followed by a question and answer period for the duration. We would ask that when you have a question to please enter it in the question and answer section as opposed to the chat. You should see the question and answer icon on the bottom right of your screen in the Zoom webinar application. Once pressed, the window will open to submit your question. If you have any technical questions, please enter these into the chat section and someone will help you. Also, please note that you will find links to tonight's presentation, as well as a link to the Canadian Concussion webpage, where you will find videos of our previous webinars. Just prior to getting started, we will run a very quick poll. Christian will do this. He puts up a question and please answer. For this evening's sessions, I'm very pleased to introduce, oh, and there it is. Actually, I'll wait for you guys to answer. I guess Christian will let me know. Okay, I guess everybody has answered. So for this evening's session, I'm very pleased to introduce Dr. Robin Green, who's going to be presenting Persisting Problems with Attention, Speed of Processing, Memory, and Executive Functions. Dr. Green is a clinical neuropsychologist and senior scientist in cognitive neurosciences at University Health Network, Toronto Rehab, and she's the Saunderson Chair in Acquired Brain Injury. Her program of research addresses brain and behavioral mechanisms of recovery from traumatic brain injury. Her lab is focused on neural, cognitive, and mood functioning in chronic stages of mild to severe brain injury in order to develop evidence-based treatments. Her lab has focused more recently on the development of novel interventions for concussion and for long COVID. Recently, Dr. Green and colleagues founded the Tele-Rehab Center for Acquired Brain Injury, a provincial research center where patients across the province receive remotely delivered interventions through participation in research. Patients range from months to decades post-diagnosis. The center studies brain behavior relationships, neurodegeneration, and novel brain injury treatments, while concurrently filling a very significant gap in the clinical care for chronic brain injury. Dr. Green completed her PhD at Cambridge University and her clinical neuropsychology training at UHN in Toronto. So it's my great pleasure to leave you with Dr. Robin Green.
Hi, everybody. Thanks, Carmela. It's my pleasure to be here tonight to talk about persisting effects of concussion. Let me just share the screen. Okay, Okay, great. I'm going to be building in part tonight on the talk given by Dr. David Gold a couple of weeks ago. Some of you may be contending with ongoing cognitive symptoms of concussion yourself. Others may be family members or clinicians of individuals with prolonged symptoms of concussion, prolonged cognitive symptoms. So I hope I can provide you with some helpful information and direction in my talk. I've organized the talk. Well, first of all, I don't have any conflicts of interest. So I've organized the talk into 3 parts. Yeah, if you just give me 1 second here. Okay. So first I'm going to talk about the first part is going to talk about the most common cognitive symptoms and how they manifest in everyday life. And this is actually very important because sometimes cognitive symptoms of concussion can be misread. Our group, in fact, was involved in some research on this that touches on this topic. We work with patients who were in accidents that resulted with severe musculoskeletal and or spinal cord injuries along with concussion. And these patients went into rehab. And in many cases, the concussion wasn't diagnosed. And the individuals, as a result of their cognitive symptoms, missed appointments. They didn't always follow instructions. They got easily frustrated, forgot what they'd learned in sessions, and they would sometimes get wrongly branded as not making an effort or even being difficult. So it's really important to have a full understanding of concussion symptoms or cognitive symptoms of concussion, what they may look like for yourself. You know, and also as you gain expertise on this topic, you can also educate other people. So the second part of the talk is going to focus on the causes of persisting cognitive symptoms. And here there's a real focus on symptoms that we can target with management strategies and interventions. I'm going to talk about direct effects of concussion and direct effects on cognition of the concussion and indirect causes of cognitive symptoms. And then lastly, I'm going to talk about management strategies and interventions. And I'm going to talk about managing indirect causes, symptom by symptom, interventions that are associated with neuroplastic change. And if time, I'll talk about cognitive strategies. So here's some common cognitive symptoms after concussion. So I'm going to start with attention and concentration, and that includes focusing, dividing, sustaining, shifting, and selecting attention. And I'm going to talk about processing speed. So we can talk about verbal or visuospatial processing. We can talk about how quickly we can scan. And what does that look like in everyday life? That can look like, for example, zoning out, being forgetful, being distractible, having trouble following conversations, repeating questions, having difficulty learning new things because, of course, attention affects memory, and taking more time to do things. Another common symptom, of course, is learning and memory. So we can talk about immediate and long-term memory. We can talk about prospective memory, remembering to remember. So, and we can talk about input or versus retrieval of information. And in everyday life, forgetting instructions, conversations, things about people, not following through on things because you've forgotten what you were asked to do. This, of course, isn't a comprehensive list. And then executive functioning. And in fact, executive functions include a really wide range of capacities that are involved in goal-directed behavior. And that can include multitasking, problem solving, working memory, which involves holding information in your mind's eye, planning, organizing, not being impulsive, not being disinhibited, regulating our emotions, judgment. All of these fall under the umbrella of executive functions. So in everyday life, and executive functioning is really commonly disrupted after concussion, and it's one of the common persisting effects. In everyday life, what can that look like? It can look like someone may interrupt because they're more impulsive. They may be more impatient. They may have trouble getting going during the day, getting going with any task. They may not complete tasks. And I'm going to talk a little bit about how to improve getting tasks completed later on in the third part of the talk. It can look like you're not interested in, or you're not following someone's advice. A person may lash out, may curse, lose their temper, get into fights. So these are all cognitive, these are all a range of cognitive symptoms after concussion. And of course, all of these have implications for safety, for example, driving, biking, sport, implications for school, getting back to work, for social situations, personal relationships, and more. So I'm going to move on to the causes and perpetuators or exacerbators of cognitive problems after concussion. So in terms of direct organic effects of concussion, I know that not last week, 2 weeks ago, the presentation for Dr. Gold talked about that. So what I just want to flag in terms of the organic effects of concussion is that, there is evidence that each concussion leaves its footprint on the brain, or may leave a footprint on the brain. And there's a cumulative effect of multiple concussions. And so prior concussions do make things worse. They make recovery take longer, and they can make symptoms more significant. But what I really want to focus on is the causes of the indirect causes or exacerbators of cognitive symptoms in people who have prolonged symptoms. And this is really important because, we're always focused on things that we can modify. And what are some of the examples of these? Sleep disturbance or fatigue, headache pain, other pain, mood, anxiety, medications, and any substances with an impact on thinking, like sleeping pills, cannabis, specifically THC, attention deficit hyperactivity disorder, neurocrine problems, tension problems. All of these can affect our cognition. And in the context of people with prolonged symptoms of concussion, these are all things that may have been there prior to the concussion, or they may have emerged since the concussion. And one of the things that we talk about a lot in concussion is this vicious cycle of concussion, where we have an injury, and the injury can give rise to any or all of cognitive symptoms, primary cognitive symptoms, primary mood symptoms, or primary somatic symptoms, like problems with sleep and pain and light sensitivity. And but what happens is there's an interplay between these symptoms. So for example, let's say we have problems with let's say the concussion causes problems with mood. Let's say we develop some anxiety. Well, that anxiety can have an impact on our sleep. And that compromised sleep can have an impact on our cognitive functioning. And you can see this vicious cycle here, and the reduced cognitive functioning in turn exacerbates symptoms of anxiety. So you can see the two-way arrows, and you can understand that interplay. And so it's really important for us to try to break that vicious cycle, and I'm going to talk a little bit about that. But before I get into that, what I want to talk about is the importance of attention. It's a core cognitive function, and it can be a primary driver of other cognitive problems. So there are many different types of attention. We can talk about there's selective attention, or the gatekeeper for other information. So selective attention involves focusing on one thing and filtering out other. There's sustained attention, so staying focused, resisting distraction. Attentional shifting or dividing attention. So this is the ability to shift our focus between tasks and to multitask. And working memory. So this is the ability to hold information in our conscious mind, or our mind's eye, and work with it. And attention is very special because it underlies all other cognitive processes. We need attention to do anything, to learn and remember, to scan a page, to read, to engage in a conversation, etc. And an important thing to know is that attention it's all over the brain. It's controlled by neural networks that are distributed across the brain. So, but that distributed nature of attention in the brain makes it more vulnerable. It's easier to disrupt those networks. And so because of that distribution of attention across the brain, it really makes it more susceptible to any fluctuations in our physical and our mental state. So anything that might decrease the brain's processing efficiency, poor sleep, fatigue, a cold, etc., is going to disrupt attention. And that's going to have an impact on all of our other, a potential impact on all of our other cognitive functions. For example, you know, we have to maintain our attentional focus to take in and learn new information. If we want to engage in conversation, we have to hold information and ideas in our working memory, in our conscious mind to be able to read, to be able to follow conversations. And in terms of executive functioning, planning, multitasking, we need to be able to pay attention. We need to be able to hold information in our mind's eye. So really a key takeaway here is that we can improve our attention by maintaining optimal physical health, by treating other factors that can affect attention, like sleep, mood, and pain, that can improve our overall cognitive functioning. And there's one other thing that I want to talk about, and I'm always a little bit hesitate to talk about this because it can come across as though one is minimizing cognitive symptoms and the enormous day-to-day challenges. But it's really, you know, I think knowledge is power, and I just want to make sure that you're familiar with this idea, the good old days bias. There's a lot of interesting and important research on it, and what it refers to is this overestimation of our capacities before the concussion. We call them misattribution errors. So the tendency to, when we consider our life before concussion, to say to ourselves, well, I never made cognitive errors. I never forgot where I left my keys, had trouble remembering a person's name or my PIN, had a word on the tip of my tongue I couldn't remember, had difficulty troubleshooting complex problems, didn't feel like finishing my homework. Why is that important? Because over attributing the causes of errors to concussion can be demoralizing, can increase our anxiety and stress and lower our mood. And in fact, it's really hard to know the cause of an error in any given situation. Of course, we know that the prolonged effects of concussion may cause some or most or all of our errors, but it's also important to remember that we also made errors before the concussion. Okay, so I'm going to move on to management treatments for concussion. So I was talking about that vicious cycle, and what's really important is focusing on treating on treatable targets that contribute to that vicious cycle. And what we often recommend is to target 3 of the drivers, very treatable drivers of other symptoms, and in particular cognitive symptoms, specifically headache and pain, sleep and fatigue, and mood. And how do we do this? Well, first of all, we simply need to evaluate or self-evaluate. So evaluate our sleep, our fatigue, our pain, stress, and anxiety. If you want to do that with tools, there are tools that you can use. The Ontario Neurotrauma Foundation guidelines, I've got the link at the end, offer some tools for doing that. And then what we always recommend is addressing symptom by symptom. So there are a lot of different approaches for tackling each of these. We don't want to necessarily tackle them all at the very same time because it's difficult to figure out what's causing what. So in terms of addressing the symptom of sleep problems, there's cognitive behavior therapy that you can get. It's called Insomnia CBT or CBTI. There are apps that you can use for that. Improving sleep hygiene, talking to your family doctor about medications and or sleep study. For pain, again, you can talk to your family doctor about medications, try over-the-counter medications. I'm going to talk to you a little bit about mindfulness and about pacing, which are 2 other options for improving or helping to reduce pain. For stress and mood, there's cognitive behavior therapy, mindfulness again, psychotherapy, again, of course, medications. And lastly, for fatigue, energy conservation. So let me start by talking about fatigue. And here are some recommended general strategies. So they include energy conservation, including pacing. And I'm going to dig deeper into pacing in a moment. Stress management, exercise, mindfulness, which I'm going to talk about, cognitive behavior therapy, setting priorities, being aware of medication effects, as I mentioned before, medication side effects of any medications that are psychoactive, that can make you sleepy, that can give you brain fog, and managing sleep. And so, again, when we tackle fatigue, that has a knock-on effect on cognitive symptoms. Okay, so continuing with this topic of treating indirect causes of cognitive symptoms and trying to break the vicious cycle, I want to talk about energy conservation and the 4 Ps. So this is an approach that you can use to manage your energy to help your brain and body rest. So conserving physical and mental energy to complete your daily activities successfully and enhance cognitive functioning involves these 4 Ps. The first is prioritize. Prioritizing what is most important? Is the activity urgent? Is it important? For example, can be done the next few days. Can we delay it a little bit? Something that can wait, that you don't need to do, that you can't do? Is it something that someone can actually do for you? Planning. What are you going to do? And when are you going to do the activity? How are you going to organize your activities? For example, when do you feel best throughout the day? Can you try to do your activities at, let's say, in the morning, if that's your optimum time of day? What else do you need to do today? And it's really important to make rest breaks a part of your routine. Try to, how are you going to do it? Take breaks when necessary. Remember, it may take more time to complete tasks. Break tasks down into smaller stages and spread tasks out throughout the day. Position, where are you going to do it? So this is the 4th P. Consider the environment. Will there be distractors? Are there lights that are aversive to you in the background, or that may cause headaches as they flicker on your screen? What is your body position? Are you walking all the time? Are you able to take breaks? Okay, so I'm going to now move on to treating cognitive symptoms. And what I want to talk about are some approaches that have evidence of efficacy. And we're always concerned, those of us that work in the field of concussion, we're always concerned about what's out there that doesn't have efficacy, that is sometimes sold to people, or that can even cause harmful side effects. So we're really mindful of, no pun intended, of promoting treatments that have efficacy, scientific efficacy behind them. So one of the treatments that is beneficial for cognitive symptoms is mindfulness meditation. And mindfulness meditation refers to focusing on being highly aware of what you're feeling and sensing in the moment without interpretation or judgment. And mindfulness, there are different types of mindfulness. Sorry, that is a type of, I was just describing mindfulness as a type of meditation, but mindfulness itself is to be fully present and aware of where we are and what we're doing, and not being overly reactive or overwhelmed by what's going on around us. And it helps us to regulate our emotions and to focus better. So there are, for example, there's mindfulness-based stress reduction, mindfulness-based cognitive therapy. And mindfulness has shown nice benefits for sustained attention. So, holding our attention over time. It's got indirect consequences for reducing those other symptoms of concussion that can affect cognition, like mood and sleep. And there's evidence that it even shows functional reorganization of the brain, increased cortical thickness. So we really are promoters of mindfulness. And there are a lot of apps that you can get to self-administer guided meditations. Another approach with evidence of efficacy is called allocentric spatial navigation. And that's navigating through space using allocentric coordinates. So what do I mean by that? So creating kind of a mental map of space. And when you navigate, instead of saying, okay, I've got to remember to turn left at the bank and I'm going to turn right at the bakery, but you actually create a mental map of space that's not self-referential, that actually stimulates and activates the hippocampy, the memory structures of the brain, and it's associated with enhanced hippocampal structure and function. So what can you do in your everyday life to try to engage in allocentric spatial navigation? You can turn off your GPS when you can, or if you're a passenger in a car, you can try to navigate in your head without looking at the GPS. And just in general, try to practice making a map of your mental space. It's good for your brain. An intervention with evidence of efficacy is called goal management training. And this is a program for improving planning, organization, follow through, to improve our ability to achieve our goals. So one fundamental goal management problem is failing to stop and just assess the elements of tasks, and also to know what we're actually doing in a given moment. And so GMT involves providing strategies such as the stop technique to tackle this. It's just stop. Where am I? What am I doing this moment? I need to get back on track. And it helps us to understand how to integrate that in all of our tasks. Another goal management problem is not, and this is goal management, you'll know or remember, is an executive function. Another goal management problem is not having control over attention. So being absent-minded, kind of slipping into autopilot and contending with resulting forgetfulness. So goal management training provides strategies to help stay on track with our tasks and be more productive. And it incorporates and to prevent that absent-mindedness, that autopilot. And some of the additional techniques, in addition to the stop technique, involve basic mindfulness skills, goal definition, splitting up your task into component parts, and monitoring what you're doing. Okay, so also in terms of approaches with evidence of efficacy, a really important concept to know about is neuroplasticity, and that's the capacity of the brain to change and rewire itself based on experience. And environmental enrichment, you can think of use it or lose it, promotes neuroplastic change and healthier aging. So even in the absence of concussion, this is a really important concept and important to integrate in our lives. And there are three broad types of environmental enrichment. So one is physical exercise. You've heard of perhaps exercise as medicine. There's really nice research in animals anyway, that physical exercise helps in the proliferation of new neurons in the brain. So you can aim for daily physical exercise. There's benefits for brain health, growing evidence for concussion symptom resolution, and also benefits on mood and, of course, thinking abilities. So track your physical activity and just try to gradually increase it. Another category, as I mentioned, is another category of environmental enrichment is cognitive. So this is mentally effortful activity that's continuously novel, challenging, effortful, engaging, intensive. And animal studies show that this actually promotes the survival of new neurons and their integration into the brain. Try to learn something new, do thinking activities, change them up a lot, read and try to memorize what you're reading, test yourself on what you've read, on your memory for what you've read, learn a new musical instrument, a new language, etc. And then social, there's evidence that social interaction is also beneficial for the brain, and it's type of environmental enrichment. And we know that the flip side of that, isolation, is not good for us and not good for our brains, associated with depression, which is associated with reduced cognitive function. So try to get out there and engage with people, ideally on a daily basis. Okay, so I'm gonna wind up with some takeaway messages for you. So cognitive impairments can manifest in complicated and not necessarily obvious ways in our everyday life. There are direct and indirect causes of persisting cognitive symptoms after the concussion. So there's the direct effects of concussion on the brain and underlying effects on the brain. Underlying causes of cognitive symptoms that are directly caused by the brain, and also perhaps more indirectly caused by pain, fatigue, and attentional dysfunction. Attention does play a disproportionate role in all aspects of cognition, and attention can be disrupted by both physical and mental health factors. We talked about misattribution errors, or overestimating capacities before the concussion and attributing every single error that we make to the concussion, rather than, let's say, only some of our errors to the concussion. Because if we overestimate, that can increase our stress and our worry. Management approaches. There isn't a magic bullet. It's important for us to acknowledge that. But we can address those indirect causes and try to break that vicious cycle that I talked about earlier. We can consider interventions and practice strategies like goal management training, mindfulness meditation, allocentric spatial navigation, and we can enhance our brain health through mental, physical, and social stimulation. So thank you. And I'm going to stop sharing.
Thank you, Dr. Green. We're now opening up to questions. So just a reminder to please type your questions into the question and answer section. So that's at the bottom right. On mine, it's right next to record, if you hover over the application. While we get more questions, I'm going to start with the ones that I already see in the chat. And so the first one, I have a self-perceived high baseline. I often get the comment, your brain seems just fine to me, but I know the difference a few concussions later. I have been through a couple of biased neuropsych assessments, but without the results being explained to me or recommendations given. I wonder how it's measured, how much effort it takes me to process something. I'm still smart, intelligent. I just have a lot less brain battery available. Can you talk to me to any of these, please?
That's a really important set of points that you're making. I can't actually see that actually, but is that in the chat, Carmela?
It's under question and answer.
Oh, I see. Yes. Okay. I was looking in chat. Okay. You know, it's concussion, cognitive effects in concussion are subtle, and they are very hard to capture with neuropsychological assessment. We never recommend neuropsychological assessment early on. We only really selectively recommend neuropsychological assessment, and with the caveat that we may not capture someone's impairments or someone's cognitive changes as a result of their concussion. Because if someone is starting out, let's say in the 99th percentile, and they drop 10 or 50 percentile points, they're still going to be operating within the average range or even the above average range. So, you know, I'd see you comment on biased neuropsych assessments and the results not being explained to me. And I'm guessing that's an insurance-based assessment, a third party, where they're not required to explain the results. You know, something that you can do is you can bring you can ask for a copy of the results, and you can bring the results. You can request the test data and the report, and ask them to be sent to another clinical neuropsychologist or a cognitive neurologist like Carmela, like Dr. Tartaglia, and have them decode it for you. I'm always unhappy when I hear about those kinds of third-party assessments where someone actually isn't given their clinical results. That it goes against me professionally. What often happens is that, and we saw this when we were testing university athletes a bunch of years ago, is that we'd have athletes who would sustain a concussion, a witnessed concussion, and they were desperate to go back to playing sports. We didn't have any doubts about whether they were, contending with significant effects of concussions. They were. We'd bring them in for our cognitive tests, and they would do great. And these are people who, probably like you're describing yourself, the university students maybe had a higher than average baseline, but they would do great on our testing. And but what they couldn't do was maintain that high level. So they could rise to the occasion when they were being tested, but it wasn't a level of cognitive functioning that they could maintain all day and all week. So we know that, you make the point that it takes you, you're raising a question about how much effort it's taking to process something, and you're exactly right. So often what's happening is that a person requires much more mental effort to achieve the very same level of performance. They can achieve that level of performance, but it takes much more literal brain power in order to do it.
Thank you. So the next question is, I had a concussion from a car accident in 2018. I have great difficulty concentrating on any task, especially cognitive tasks, if there's any noise, music, people walking or talking nearby. I have great difficulty concentrating on any conversations, if there are any other conversations in earshot. This makes it extremely difficult to socialize and do any cognitive task unless I'm in a very isolated area. Do you have any suggestions for how I can improve?
Right. That's unfortunately a really common set of complaints. And I talked about how significant attention is. So I would say that mindfulness meditation, which, as I mentioned, is beneficial for sustained attention, would be something that I would try. I mean, really, a lot of what I've put in the talk under recommendations are what I would try in terms of enhancing your attentional functioning. So mindfulness meditation, goal management training can help with working memory. There are medications. I'm not sure, Dr. Tartaglia, if you want to talk about medications that can sometimes show some benefits for attentional functioning. And there's some evidence that when you combine medications like methylphenidate with cognitive training, that you get a better effect. Did you want to talk about that, Dr. Tartaglia?
Yeah, I think that the issue is, so in people who have attention deficit disorder, sometimes it actually gets unmasked after a concussion. They manage to compensate their whole life, but then they have a brain injury. And some of these medications can sometimes be helpful. They have side effects. And so we often would try cognitive behavioral therapy, mindfulness, like all that, those other strategies before we would add a medication. But there are options out there for people who we do uncover an attention deficit.
And you're,
sorry.
No, I think it's probably worthwhile moving on.
Yeah. So the next one is, I feel, well, I guess it's in the same vein. I feel like I have post-concussion ADD. Can you comment on the use of ADHD medication post-concussion? Also, now I have MCAS, which I don't know what that means, and functional neurological disorder. Guess we kind of answered that. It is a consideration. Now, Rachel asks, how can we avoid overestimating our abilities before concussion? How do we know if we're doing so?
I don't want any people to feel like they need to dwell too much on that. I wanted to just make the point that we have a tendency to do it, and it's demoralizing, and to just keep in mind that, nobody ever operated perfectly, that we always made cognitive errors, that we always had cognitive slips, that we always had fatigue. And so it would be hard to measure the extent to which you're one is overestimating or overascribing cognitive problems to their concussion. But I just want it, knowledge is power. It's really important to understand all of the different things that can be influencing us. And that's why I'm telling you about those findings and that tendency for people to do that.
Great. So Brian asks, you mentioned issues with THC affecting cognitive ability. Is this true for intermittent or occasional when used as a sleep aid? Also, are there any studies on effects of CBD for sleep or cognition?
So I have looked at this literature, and there's, a difference between, there's the question of transient effects of THC on cognition, which are, well documented, and part of the reason that people are sometimes taking, consuming THC, which is to influence their mental status. But it really depends very much on the amount of THC that you're consuming. But in terms of persisting effects, I'll just say that literature, so for someone that has consumed a lot of THC over a long period of time, the literature is a little bit murky on whether there are persisting effects after a person stops taking THC, if that's the other question that you're asking. In terms, studies on the effects of CBD for sleep maybe, or cognition. I'm not, Dr. Tartaglia, do you want to comment on that? Are you familiar with that?
Yeah, I think that the main issue is that there's no CBD without THC. So you have to just figure out how much THC is there. And I agree that the evidence for having cognitive effects while you're on any amount of THC is actually pretty robust. Whether it lingers after you've stopped it is more murky. But if you look up cognitive function and cannabis usage, you will find a lot of literature on that. And Rufus asks, early in my concussion, I could not read. Why was that?
By the way, I just want to say these are all great questions. I really appreciate the questions. So what I would say, how I was talking about attention being that core cognitive deficit that disrupts other functions. My guess is that the difficulty reading was probably due to a primary deficit of really severe attentional disruption. I think that's the most likely explanation. And there are different aspects of attention that could have been disrupted, including scanning. We sometimes subsume that under attention, but your ability to sustain attention, your ability to hold information in your mind's eye, which is necessary to be able to read. If you consider moving from the beginning to the end of a sentence, you have to hold that information at the beginning of the sentence in your mind's eye as you carry on reading to the end of the sentence. And that also involves multitasking or divided attention. So there are a lot of attentional demands that are involved in reading, which we kind of take for granted in our everyday life.
So Mike asks, is there proven efficacy for chiropractic therapy for post-concussion syndrome?
I don't know of any proven efficacy. I don't know of any research that shows efficacy for chiropractics for persisting effects of concussion.
And someone asks, I'm almost 6 years out from my injury. I understand the benefits of pacing and planning. Sometimes I find that pacing and planning takes so much cognitive effort that I give up. I have trouble with decision making. Any suggestions to make it easier?
That's a really important point, because people like me recommend interventions, and the interventions themselves are tiring to learn, draining to learn, and can be draining to implement. The idea with getting training in delivering, in utilizing these kinds of things, pacing and planning, is that they become automatized. And so they take up less of your cognitive and particularly attentional resources. I'm not sure whether in your case, I guess 6 years out, you're probably by this point really efficient, and yet it's still draining for you. I would put some of it down on paper. I don't know whether you're trying to keep it all in your head or whether you're also downloading some to a piece of paper, whether that's right in front of you. Whether you've got, let's say, the 4 Ps in terms of energy conservation and pacing, whether you've got that written down. But I guess a more global suggestion that I would have for you is to implement a lot of repetition, a lot of routine and repetition, so that you don't feel like you're actively implementing strategies. So for example, you're doing the same things at the same time every day as much as possible. You are having your meals at the same time. You have the same breakfast every day, for example, so you don't have to make a decision about your breakfast. Maybe you have the same couple of lunch options, or at least every Monday you have the same lunch and the same dinner. So routine and repetition and reducing the number of decisions you have to make.
Okay, thank you. There's somebody's asking, is mindfulness safe for someone with PTSD?
So, I mean, mindfulness is sometimes used for that. I don't know if there is literature on adverse effects of mindfulness for PTSD. I don't know of it, but I'm not going to say that there aren't any contexts in which it could be, let's say, exacerbating. But what I'm going to do is I'm going to send a text off to an expert while I'm answering your questions, and I'm going to try my very best to multitask. So I'm going to see if I can get your question answered.
Okay, great. Thank you. Somebody is asking, Leslie, are there some mindfulness mediation programs, apps, YouTube you could recommend based on your findings?
Hang on one sec. I'm
I
just
think it's mindfulness meditation. Sorry.
Okay. And sorry, oh yeah, are there mindfulness meditation based on, I named a couple, Calm, headspace.com. We recommend those quite often. Dr. Rattan, who is often facilitating these sessions, has a long list of apps. So how about if I relay this to her? By the way, she's the person that I'm going to ask about mindfulness and PTSD. How about if I ask her if she could provide that list at the next session? I'll do that.
Great. Somebody asks, can you get free goal management training?
It's hard to procure. We do at our tele-rehab center offer goal management training, and it is free, and we do offer it to people with persisting effects of concussion. I don't know about other places where you can get it. I think it's possible that Ottawa might have free, I should have mentioned remotely delivered goal management training. Ottawa may, I'm not sure.
Okay. Robin says, my daughter had a concussion more than 3 years ago. We have tried many therapies, visual, physio, neurofeedback, sacral, cranial, etc. She still has very bad symptoms. Do you know if Vilight, near infrared light, has been found to be helpful?
I know that there's research on it, and I think the jury is still out. I don't know if you know that literature, Dr. Tartaglia.
As far as I know, it has not been established as a therapy. It's not an evidence-based therapy for concussion.
I know there's also a little bit of literature on blue light therapy and a little bit of evidence of efficacy for that. Early days.
Yeah. Do you know a good valid insomnia CBT app?
I'm going to defer to Dr. Rattan on that one as well. I'm going to ask her to send that out.
This one is, does Dr. Green have a reference for clinicians to assist patients with allocentric spatial navigation training? John is asking this.
Okay, so if that clinician get in touch with me, and I can offer you something that's still experimental, that incorporates allocentric spatial navigation and that environmental enrichment that I was talking about before.
Okay. And then Brian asks, he had asked about the THC. He says he had a TBI a decade ago with severe sleep issues. After so was prescribed sleep meds like Ambien currently, but worried about the long-term effects.
Okay, can I defer to you, Dr. Tartaglia, on that?
Yeah, I think I am, of the same mind as you, taking these medications for long-term, can have effects, and Ambien is better than benzodiazepines, but still I would be concerned. And I think it's important to look into what's wrong with somebody's sleep. Does somebody have sleep apnea? Are they having trouble falling asleep? Are they having trouble staying asleep? Do they have anxiety that's waking them up at night? Is there pain? Are they having, restless legs because of low iron? There's many reasons a person has poor sleep, and I think it should be investigated with a sleep study. And then there are new medications on the market which work on the sleep system, and maybe, ask your family doctor about that, because there is a new medication that is not in the family of Ambien or benzodiazepines. I'm a clinical psychologist. How can I refer a person with head trauma and cognitive deficits and headaches to your program, Dr. Green?
Sure. You can, again, get in touch with me offline, and I'll give you the contact information for the administrative coordinator.
Okay. And Joel asks, I too had a third-party assessment that found I was well above baseline. However, my processing speed is not what it used to be, and mental fatigue occurs much faster.
Yeah, and that actually, I could only talk so much about neuropsychological assessment. I know Dr. Gold talked about it too. So that, you've just illustrated the way in which we can tell whether somebody has a cognitive effect of a concussion by looking at disparities between performances. So for example, if we see that, let's say somebody's in the 75th percentile for all of their, on all of their measures and all of their cognitive domains, but in one area, they're in the 25th percentile, like processing speed. Even though that's right within the average range, that big disparity between 75 and 25 is, flags for us that this may reflect a consequence of the concussion. You said that, I'm just trying to find your exact comment about about fatigue. I've lost it.
Having mental fatigue now. Where is it? So many questions.
What's the name of the person that just?
Yeah, that's a good question. I've forgotten.
Okay, hang on.
Yeah, I think it was they were having mental fatigue with their activity.
That was exacerbated. I think that mental fatigue was exacerbating the processing speed. And that's a really common thing that we hear, is that, kind of like I was talking about the athletes who could rise to the occasion, but couldn't maintain that level of functioning all day or all week. And so one might have, be able to, for 10 minutes or an hour, especially during their good part of the day, let's say it's the morning, let's say that happens to be the morning, operate with their own usual processing speed. But if you're pushed for, beyond a particular threshold, or if you're having to process information quickly, during a lull, what is now a lull since the concussion for you in your mental functioning, let's say the afternoon or the evening or after a busy day, that's when the processing speed might get lower. And, and we always recommend practical strategies apart from the recommendations for trying to improve processing speed through all the different strategies and treatments. We would recommend the kind of the obvious. So if you have to think really quickly, try to do that. Figure out what your freshest time of the day is, and do it during that period of time, and try to figure out what your own limits are. And sometimes it's possible to extend the duration of your your optimum mental functioning period by taking breaks. So you might want to try taking breaks before you hit a wall. Take a break, a true break, where you just close your eyes and don't do anything and don't even listen to music.
Thank you, Dr. Green. We're very thankful that you've been here and answered your questions. So we look forward to a short survey to you by email to obtain feedback on this session to all the participants. Your thoughts and input will be most appreciated if you have a few minutes to spare. Our next session will be March 7th at 6 p.m. and will feature Dr. Abe Snaderman, who's a neuropsychiatrist who's going to present on anxiety, depression, and post-traumatic stress disorder before and after concussion. Thank you, everybody. Thank you for all the great questions.
Yeah, excellent questions. Thank you. And thanks for sharing your experiences too.